This is Dr. Garth Rosenberg at Capital Vein and Laser, and I'd like to talk a minute about varicose veins in pregnancy. It's a very common problem we see, women with multiple pregnancies who find after the first pregnancy the varicose veins were somewhat symptomatic, but then after delivery they kind of receded a bit, the leg symptoms abated. Then after the second pregnancy, the veins got a little bit worse. The pregnancy was a little tougher to tolerate. After the baby delivered, the veins were still there, and then perhaps the woman got ill-informed advice that she ought to wait until she's done with all pregnancies until getting the veins fixed. And then she'll have a third pregnancy and have very symptomatic, painful, large varicose veins that really cause significant disability, leading to the need to elevate the legs, wear support hose constantly, and even despite that, as the months of pregnancy go by, the veins get bigger and more painful. What I'm here really to do is educate both patients and physicians on the need to intervene on varicose veins between pregnancies instead of waiting until all pregnancies are finished. The reason varicose veins occur is because the small, fine one-way valves in the leg veins that normally propel the blood up the leg from the lower leg up to the groin fail. They get weak or damaged some way. And as gravity is constantly pushing backwards, the blood is pooling in the veins, causing the surface veins to bulge. When these veins bulge, and then they cause the aching, heavy, tired, swelling, and even restless legs that people experience. And you should know that treatment of your varicose veins is exceedingly straightforward, quick, relatively painless, and very effective. The most common way we treat vein reflux is called the closure procedure, and this has been around since the year 1999 when it was FDA approved. And this is an office-based 15-minute procedure that allows us to close the vein, the leaky vein in the leg, preventing the backflow or pooling of the blood, and your normal veins take over, bringing the blood up the leg, restoring normal circulation. The procedure is done by giving you a little numbing around the knee on the inside of the leg, and we insert a small IV there. Through that area, we slide a tiny wire up towards the groin in the vein. And interestingly, the veins have very few nerve fibers on the inside, and you won't feel the wire sliding up the vein at all. We'll give a little local anesthetic, and then we'll retract the wire, which has a heated tip. And as we do that, the vein is slowly closing and sealing shut. The advantage of this is that it prevents the backflow of the blood in the leg, causing the symptoms to significantly improve, and your normal veins take over quite quickly, bringing the blood up the leg. There's an abundance of veins in the leg, so closing one vein is actually quite helpful to the leg circulation. You won't miss that vein at all. The biggest thing we want to advise patients, and especially women in the pregnancy years, is when they have varicose veins during pregnancy, they ought to seek advice and testing with a vascular surgeon once that pregnancy is finished. Even though the legs may look better and feel somewhat better, the internal damage to the valves is still present. And subsequent pregnancies cause a worsening condition, which is quite discomforting for the patients. Naturally, we can't do much in the way of treatment during pregnancy, and all we can do is advise a leg elevation and support hose, but treatment after the pregnancy is finished, as I said, is very easy and successful. And you should know that varicose vein treatments are covered by most insurance companies. It's not a cosmetic procedure. So we strongly advise patients to seek the advice and counsel of a vascular surgeon with many years' experience treating varicose veins. Both Dr. McNeil and myself are vascular surgeons with over 30 years' experience of intensive treatment and interest in venous disease. We both teach locally, nationally, and internationally, and we've been part of FDA trials looking at newer investigative techniques for treating venous disease. We'll individualize the treatment for each patient and make sure the best outcome is achieved.